Most people trying benfotiamine make the same mistake. They hunt for it in foods. You won't find it there. It's a special form of vitamin B1 that only shows up in supplements. In this video, we'll tell you exactly what it is, how it works, who might benefit, and how to use it safely without wasting money. Quick heads up before we go further, this video is educational and not medical advice. Talk with a qualified clinician before changing any supplements or medications. Benfotiamine may help if you want support for healthy nerve comfort, steady carbohydrate metabolism, or if your diet is low in B1. People who drink alcohol frequently, use certain diuretics, eat lots of refined carbs, or have had stomach or weight loss surgery may have higher B1 needs and could be candidates to discuss it with a clinician. If you're pregnant or breastfeeding, stick to standard prenatal amounts of thiamine rather than high-dose benfotiamine unless your clinician says otherwise. If you take medications that lower blood sugar, monitor closely and check with your prescriber because improving B1 status can change your numbers. One safety note, start low, go slow, and stop if you notice rash, itching, or unusual dizziness. One action step for today, look at your diet and your multivitamin. Make sure you hit the basic B1 intake first with food or a standard B complex, then consider benfotiamine if you and your clinician think you need extra support. So what is benfotiamine in plain language? Vitamin B1, also called thiamine, is a nutrient your cells need to turn carbs into energy. Benfotiamine is a fat-friendly version of B1 designed to get more of the vitamin inside your tissues. Think of regular thiamine as a paper ticket that sometimes gets torn at the door. Benfotiamine is the VIP pass that slides you through the line so more B1 shows up where it's needed. Here's how it works in the body. First, benfotiamine is converted into active thiamine inside your cells. That active form powers enzymes that move sugar through clean pathways, so you make energy instead of sticky byproducts. Second, by supporting an enzyme called transketolase, it nudges glucose toward the pentose phosphate pathway. That pathway makes NADPH, a helper molecule that your cells use to recycle antioxidants. Third, by keeping sugar moving smoothly, benfotiamine helps limit the formation of advanced glycation end products, or AGEs, which are the caramelized compounds that can build up when sugars stick to proteins. In simple terms, it helps your cells burn fuel cleanly and may ease metabolic stress on nerves and blood vessels. Humans can't manufacture vitamin B1. We have to get it from food or supplements. Your need for B1 goes up when you eat more carbohydrates, during heavy training, with frequent alcohol use, and with conditions that affect absorption, like certain gut issues or after bariatric surgery. Some medications, especially loop diuretics that increase urination, can also increase B1 losses. Let's start with food and habits before we talk supplements. Great food sources of thiamine include pork, legumes like lentils and black beans, sunflower seeds, brown rice and other whole grains, fortified breakfast cereals, and nutritional yeast. Light, heat, and a lot of water can wash B1 out of foods, so gentle cooking helps. Eating protein and fiber with carbs can also steady how quickly sugar hits your system, which complements what B1 does. Benfotiamine itself isn't in foods, it's a supplement option used when you want higher tissue levels of thiamine than diet alone provides. What does low B1 look like? Early signs are vague: fatigue, irritability, loss of appetite, and muscle weakness. As it gets worse, you might notice tingling or burning in hands or feet, poor balance, calf cramps, or mental fog. People at highest risk include older adults, those who drink alcohol often, people on chronic diuretics, folks with very low-calorie or highly refined diets, and anyone with conditions that reduce absorption. If you want to check your status, ask your clinician about whole blood or red blood cell thiamine diphosphate testing. That reflects what's inside cells. Some clinics also measure an enzyme activity test related to transketolase or look at urinary thiamine. Serum thiamine alone is less reliable because it can bounce around with recent meals. Let's take a look on what evidence says.
For nerve comfort in people with mild symptoms, the research is mixed to promising. Several small to medium randomized trials, usually lasting 4 to 12 weeks with dozens to a few hundred participants, report improvements in tingling and overall nerve symptom scores when benfotiamine is used, sometimes alongside other B vitamins. Not all studies agree and designs vary, so I'd call this evidence mixed but encouraging. For glycation markers and general metabolic stress, short-term human studies and mechanistic work show reductions in certain byproducts that form when sugar and proteins combine. That's preliminary for day-to-day outcomes, but the direction is positive. For heart and vessel health markers, early studies suggest possible support for endothelial function, but sample sizes are small and the follow-up is brief, so the evidence is preliminary. For mood or brain function, data are limited and early. We don't have strong conclusions. The bottom line is strongest signals are for supporting nerve comfort and healthy handling of glucose byproducts, with other areas still emerging. If you're looking to buy any supplements, here's how to choose wisely. You'll see benfotiamine as a standalone capsule or in blends with other B vitamins or alpha-lipoic acid. Don't confuse it with thiamine HCl or thiamine mononitrate, which are water-soluble B1 forms, or with TTFD, a different fat-friendly form, sometimes called allithiamine. Typical effective ranges for benfotiamine are about 150 to 600 milligrams per day, often split into 2 doses. Most people start at 150 to 300 milligrams once or twice daily. You can take it with or without food, but taking it with a meal often feels gentler on the stomach and fits better with routines. The daily recommended intake for thiamine, from all sources, not benfotiamine specifically, is roughly 1.1 to 1.2 milligrams for most adults. There isn't a well-defined upper limit for thiamine because it has low toxicity, but that doesn't mean unlimited is better. Stay within common ranges unless your clinician advises otherwise. Look for third-party testing seals like USP, NSF, or Informed Choice to reduce the risk of contamination and to confirm what's on the label is in the bottle. For cost, do simple math. If a bottle has 120 capsules of 300 milligrams and costs $20, that's about 17 cents per capsule. Taking 300 milligrams twice daily would run about 34 cents per day. Let's talk safety and interactions. Most people tolerate benfotiamine well. The most common side effects are mild and can include nausea, stomach upset, headache, or a skin rash. Red flags that mean stop and get help include hives, swelling, trouble breathing, or severe dizziness. If you take medications that lower blood sugar, keep an eye on your readings when you start or change your dose. If you use diuretics long-term, discuss B1 testing since those drugs can increase losses. If you've had bariatric surgery, work with your care team on routine B vitamin monitoring. During pregnancy and breastfeeding, stick to established prenatal amounts of B1 rather than high-dose benfotiamine unless your clinician says otherwise. We don't have enough high-quality data on benfotiamine in those groups. Kids should only use it under medical guidance. Who likely benefits and who likely won't? Here's a simple path. If your diet is low in whole grains, legumes, and fortified foods, or you have risk factors like frequent alcohol use or long-term diuretic therapy, first aim to meet the basic B1 requirement through diet or a standard multivitamin or B complex. If you still have signs that suggest you're not getting enough or you want extra metabolic and nerve support, benfotiamine may be reasonable to consider with your clinician. If your diet is balanced, you have no risk factors, no symptoms, and your B1 markers are normal, added benfotiamine is less likely to make a noticeable difference. What's new lately? Recent small studies continue to explore how benfotiamine influences nerve conduction measures and subjective nerve comfort when paired with standard care. Findings lean positive, but are short-term and involve modest sample sizes. There's growing interest in how it might influence markers of glycation and endothelial function after high-carb meals. Early results show shifts in lab markers, but we still need longer trials that look at how people feel and function. Researchers are also asking whether different delivery forms change absorption meaningfully. So far, differences exist on paper, but head-to-head outcome data are limited. How should you combine it with lifestyle? Think of benfotiamine as part of a routine, not a replacement. It pairs well with a well-rounded B complex to cover the family of B vitamins that work together in energy pathways. Many people also combine it with magnesium, which helps enzymes that handle carbs and nerves. Some choose alpha-lipoic acid alongside it for additional antioxidant support, but keep your clinician in the loop, especially if you track blood sugar. Alcohol competes with thiamine by blocking absorption and increasing loss, so cutting back is one of the best stacking moves you can make. Timing is flexible. Morning and midday doses work well for most people. If you take 2 doses, space them by at least 6 to 8 hours. There's no strong evidence it keeps you awake, but many prefer not to start a new supplement right before bed. Let's build a quick, practical plan for a few personas. If you're a budget-focused eater who wants basic support, center your meals on beans, lentils, whole grains, and sunflower seeds, and consider a standard multivitamin that includes B1. If you still want an extra boost, add benfotiamine 150 mg with breakfast for 2 weeks, then reassess how you feel and talk with your clinician about whether to continue or adjust. If you're vegan, you can hit B1 through fortified cereals, whole grains, legumes, and nutritional yeast. If you choose benfotiamine, start at 150 to 300 mg with a meal and keep an eye on how your energy and nerve comfort feel over 4 to 8 weeks. If you're on medication that lowers blood sugar, involve your prescriber first.
If they agree, start at 150 milligrams daily, track your readings closely for 2 weeks, and adjust your plan with their guidance. Here's the recap. Benfotiamine is a specialized form of vitamin B1 that helps your body move sugar through clean energy pathways, supports antioxidant recycling, and may help your nerves feel more comfortable. It's not found in foods, so start with diet first, then consider it as a targeted add-on. The best evidence today is mixed but encouraging for nerve comfort and for improving lab markers tied to glycation. Use common dose ranges, choose a tested product, watch for mild side effects, and involve your care team if you take blood sugar-lowering drugs, diuretics, or you're pregnant or breastfeeding. Now I'd love to hear from you. If you tried benfotiamine, what dose and timing worked best for you, and what did you notice over a few weeks? Drop your experience in the comments so others can learn.